Hey everyone, now we are going to start talking about equine diseases. This lecture, well, this could be an entire course. So we are going to list a lot of diseases here, but only really get into a few of them. The others are just kind of for a little bit of need to know, just for general information. Okay, so to begin with, we're going to talk about foal diseases. The only one we're really going to focus on are hernias. But when you have foals, it can get all kinds of problems: umbilical abscesses, patent urachus. That's when the urachus, which is the waste tube out of the umbilicus, doesn't close properly and it ends up leaking. So they end up leaking urine from their belly button, essentially. Prematurity or dysmaturity. So they're either born premature, or even though they are born at the correct time, there is something wrong. Septicemia. This often happens secondary to umbilical infections, ascending bacterial infections. They'll become septic very easily. They'll also get something called joint ill, a lot of joint infections. And then there's also neonate maladjustment syndrome, or dummy foals. This, we're not really sure why this happens. Often we think somehow there's some amount of oxygen deprivation, usually during actual birth, sometimes maybe a little bit, maybe even sooner. And the foals are born and they can range from just being a little slow to stand, slow to nurse, slow to figure out nursing, to downright down and out. They are what we call mat babies. They need ICU care, etc. As I said, all of that is hopefully a lecture we'll cover maybe towards the end of the semester, a little bit of neonatology because it's really worth knowing about. Right now we're just going to talk about umbilical hernias. So a hernia, like with any animal, is the protrusion of an organ or something. It doesn't necessarily have to be a specific organ, through the wall of its containing cavity. So quite frequently, umbilical hernias in horses, also in calves, will be like omental fat will protrude through the umbilicus. It doesn't quite close properly, and a little fat will get through. This can be very common in young foals. Obviously, more extreme or serious problems, you can also not get fat, but you could get intestine in there, which is the biggest concern, because if that intestine gets constricted, then you have dead intestine, and you can imagine that requires surgery. It can cause colic, etc., etc. They can get umbilical. Also common in foals can be scrotal or inguinal hernias. Usually the idea is, especially maybe the pressure from delivery, larger foals can force fat or even intestine through the inguinal canal, or through the inguinal ring, inguinal canal, into the actual scrotum. You can usually see these pretty quickly. All of a sudden, a lot of foals don't even have descended testicles at birth, and all of a sudden they'll have a very full scrotal sac or a lump in their inguinal region, so right on the inside of their hind legs. Some of these, if they're small, they may self-correct. The fat, whatever, will remove it, kind of just suck back into the body, and the hernia can close. Some are what you consider reducible. Pretty much if it's a very small one, and several times a day you can take your fingers and push whatever is herniated back through the wall, maybe only 1 or 2 fingers width of size back in, and do that several times a day. It will close. And then others require actual surgery to replace the contents and repair the defect. So especially if it's more than 2 fingers big, you'll want to actually perform surgery and close it. And especially if you're concerned that it's not just fat getting through there, but intestines, etc. And if you do suspect it's intestine, so you have a large hernia, you want to maybe ultrasound it, see if you actually see intestine. If that's the case, you need to get that animal to surgery, because as I said, things can get constricted, twisted, etc. in the hernia sac, and then you end up having more severe complications, and which can cause herniation and death. So here is a hernia right there. You can see that is an umbilical hernia. That actually looks like an older foal, so it must have had a defect that just never closed. So now that animal would probably need actual surgery in order to heal. So reproductive diseases, there's 4 that we think about most commonly. CEM, contagious equine metritis. This is something that is actually tested for. When horses come in from the other countries, they have to go through CEM testing before they can be allowed out of quarantine. Endometritis, or infection of the endometrium, the lining of the uterus. This can either be Usually you don't know that they have these infections. They may get sick. Sometimes just an underlying issue that causes problems with fertility. Granulosa cell tumors. So these are tumors that form usually on the ovaries of a mare, and they can actually cause her to have stallion-like behavior. That's often our first clue is she starts acting very aggressive and like a stallion. And then you can sometimes see them on ultrasound. Sometimes you can palpate. You'll reach in to palpate the ovary and it's huge. And sometimes they can be really small, and you can do blood testing to look for these. They are benign, but they can become very large. And then there's EVA, which we'll talk about. So EVA is equine viral arteritis. It is a reportable disease. It's primarily transmitted through semen, and it can cause abortions, and in younger horses, they can get pneumonia. It's one of those diseases that most often the carriers, the mares or the stallions, can be subclinical, so you won't know other than the abortion. Diagnosis is viral isolation, other kinds of testing. There's no treatment for carrier stallions. You can, if they do have the pneumonia, for example, you can give them supportive care and get them through the pneumonia. But there is a vaccine, so when you're doing a lot of breeding, you may consider the EVA vaccine. Okay, so now we're going to move on to the big stuff, gastrointestinal disease. This includes colic, choke, Potomac horse fever, and salmonellosis. So colic is the biggest disease we talk about. We talk about all the time. Colic, the word colic is a general term for abdominal pain. So anywhere in the GI tract, you'll hear people talk about babies colicking. You colic anytime your stomach or anything in your GI tract hurts. And so it's a very big small term for a lot of different problems. Okay, and it can go anywhere from very mild and easily resolved to very serious to it can cause an animal to die. And really severe cases of colic can happen, it seems like, within minutes. I knew a person, her horse was standing at the fence, she patted goodbye, got on the car. 40 minutes later, her mother called her, the horse was down, and by the time she got home, the horse was dead. So it had twisted its gut, who knows how long it had been festering, but the horse seemed absolutely fine when she left and died within an hour. So otherwise, you can have horses that can colic for days, and you can have horses that can colic for 10 minutes, maybe pass a pile of manure, walk a little bit, pass some gas, and they're fine. So there's 4 general causes for colic: distension of the gut, so whether it's gas, fluid, etc. Pulling at the root of the mesentery, so if the mesentery, we'll talk about this a little bit more later. Ischemia or infarction, enteritis or ulcerations. Clinical signs, again, these can vary. Horses may have all of these. Horses may just have one of these. So rolling, laying down repeatedly. They're up, they're down. They seem very restless. Kicking at their abdomen, pawing, sweating. You may notice their abdomen looks distended. They may posture to urinate. I've had clients call me and be like, I think my horse has a UTI. Like, horses almost never get UTIs, but especially geldings will stretch out like they want to urinate and then they won't. They're trying to make room for their bellies, really. Straining to defecate, decreased bowel movements. So all of a sudden your horse usually leaves 5 piles in the stall in a 12-hour period and there's nothing. Rapid breathing and decreased appetite. And decreased appetite, I'll say, is the biggest, is the most common. It's also, even in your quietest horses, usually they won't eat, or they'll pick at their hay a little bit. But if you have a horse that isn't eating its grain, especially if it's normally a chow hound, that should always be a big sign. That always concerns me when people tell me, oh, he's got a great appetite. He didn't eat his grain last night. He hasn't eaten it this morning. That horse is colicking for some reason, most likely. So here's a foal who looks like he's rolling around, pretty uncomfortable. A very common cause of colic in foals is, especially in newborns, is meconium impactions. They don't pass that first manure and things start to get backed up. Foals will roll out and they'll actually even lie on their back with their feet in their air like a dog, FYI. So what is distension of the gut? This can be caused by anything staying in the gut, causing it to swell. Fluid, so water, sand, especially not around here so much, but down in Florida or beachy areas where there's a lot of sand in the soil, they'll get what's called sand colic. Gas, or impaction due to ingesta. The ingesta, for whatever reason, will start to build up and won't be able to move through the GI tract. It can be caused, especially impaction, decreased water or fiber in the diet, often with a lot of weather changes if horses aren't drinking enough, or at the end of the summer going into fall when they go from, softer, essentially wet grass to drier hay. Overeating concentrates, so that if they get into too much grain. Overconsumption of water. If they overdo the water, it can cause a stomach ache. And then they can just get some kind of GI spasms, if you've ever had painful gut spasms, or paralysis. The gut stops moving, the peristalsis stops for whatever reason. So tension on the root of the mesentery. So if you think back to your anatomy, the mesentery, that's what holds up, all those loops of small intestine. It's a root that kind of hangs down. It has a lot of major blood vessels flowing through it, okay? For some reason, for reasons such as torsion of the gut, so if the GI tract itself, especially the small intestine, starts to torse or twist, that will twist the root of the mesentery, potentially causing disruption of blood flow, herniation, and tumors. Ischemia or infarction, so this is dead tissue or infarcted tissue. Torsion, again, if blood vessels are if there's a torsion, the intestine starts to twist itself, etc., it can cut off blood flow. Thrombus from strongyles, so this can happen where the strongyles, if they have a heavy worm load, can cause a thrombus that blocks the actual blood flow to the intestine and kills the intestine. Enteritis or ulcers. So enteritis is any kind of like an inflammation of the GI tract. It could be proximal enteritis, so like the small intestine. Ulcers like in the stomach. And you can also get colitis. Enteritis tends to be what we call the small intestine, and colitis would be inflammation of the colon. But it's the same idea, some kind of inflammation caused by stress, disease, salmonella, parasites. So we've already talked about some of this in our physical exam PowerPoint, but again, the colic exam. You're trying to figure out what is causing the colic and what you need to do to treat. So history. How's the animal been doing? Has anything changed? Anything in its environment, not just with it. Even pasture mates, a new pasture. Has anything strange happened, like they got into feed? You changed the feed. You got a new brand of feed. Some other kind was in sale. Has the horse been sick? Has anything changed in its training protocol? And then your physical exam. If nothing else, one of the most important, if not the most important part, is the heart rate. This can often correlate to pain and give you an idea of the severity of the condition. Even the most quiet, stoic horse, if they're having a severe colic, their heart rate will be elevated. It may not be as elevated as much as you think it is. I saw a huge draft horse once whose heart rate was about 48, and then when we passed an NG tube, got about 4 buckets of reflux off of it. So obviously that guy was able to, he just was incredibly stoic when it came to pain. But you really want to get a heart rate. And you also want to make sure before you start giving pain medicines or sedation, you try to get a heart rate. I've also had clients, I've asked them if possible to get a heart rate if they have Banamine that they want to give or something to ease the horse's problems. Gut sounds. Do you hear motility? Do you hear increased motility? Where do you hear motility or where don't you hear motility? Give you an idea of where the problem is. Respiratory rate. Is that increased? Increased rate, increased effort can be from pain. Mucous membrane color. Hopefully it's still pink, moist, etc. But if you see that purple toxic line, you know things are going south pretty fast. You'll also end up passing an NG tube. I do this in all of my colic exams just to make sure, both to see if there is anything backing up into the stomach, any intestinal reflux, and also I always end up administering at least some warm water, if not some Epsom salts. Rectal exam to see if you can feel anything abnormal. And then between all this and their clinical signs, you will be able to make a diagnosis.